Infection prevention at Reading Hospital is a primary concern for us. Our unit, N5 South, is an isolation-free zone. What that means to you as a patient is we don't take any patient there that needs to be isolated. To that extent, we're going to test all of our patients coming on for the presence of Staphylococcus aureus. You may know it as MRSA, methicillin-resistant Staph aureus. Trust me when I tell you, we are testing every patient that comes onto the unit so that we make sure we are protecting all of our patients. And if it is a positive result, I will be in contact with you to discuss the protocol that we need to take from that point. CHG wipes stand for chlorhexidine gluconate. I know, a long term. We call them CHG for short. These wipes are best practice in helping to prevent infection. And in fact, in one study, these were found to have a 70% reduction in infection on total joints. You should have gotten 5 packets from your doc's office. Each packet will have 3 pouches. Each pouch will contain 2 wipes. It's going to be a little involved in doing this, I can assure you. However, it's going to help reduce the risk of infection, and that is the most important thing. The 4th night before surgery, you're going to start using these. The purpose of this product is to reduce the number of bacteria on your skin. Skin is not sterile. You're going to have a sterile product put into your hip or knee. So we need to keep as much bacteria off your skin prior to coming in as we possibly can. The 4th night before surgery, you're going to begin this, and you're going to take a shower using your own soap, and if you're washing your hair, your own shampoo. You're going to rinse off, dry with a clean towel, and after your skin is dry to the touch and room temperature, and those are the keys, dry to the touch and room temperature, then you will begin using this product. You're going to open up your packet, take 1 wipe out, and you will scrub down your knee or your hip, whichever joint you're having done, for approximately 3 minutes. If you're having a knee, obviously you're going to get the kneecap, but also above your kneecap and below your kneecap. If you're having a hip, start about from the side and go to the front, capturing also part of your upper thigh. So rub that about 3 minutes, throw that wipe away. Get your second wipe out. You're going to wipe down your left arm, your right arm, under your arms, and your shoulders and chest. The 3rd wipe will be your abdomen and belly area down to your groin. The 4th and 5th wipe are going to be your right leg and your left leg, front and back down to the toes. The very last one is going to be your shoulders down to your waist, and then follow it with your buttocks. Now you know there's that spot in the middle of your back that you generally cannot reach. If you have a loofah brush, you can pop that wipe right on it and use that loofah brush. If not, just try to get it as best you can. So you'll be doing this the 4th night, the 3rd night, the 2nd night, the night before, and again the morning of surgery. Morning of surgery, if you do not have enough time to shower, that's okay. Just wipe down with these wipes and come on into us. This whole process, from this point of you starting to use that first cloth to the last one, should take approximately 15 minutes. So after you're done using these CHG wipes, you might find that your skin feels a little sticky. That's normal. That's what we expect. Don't rinse them off. This is protecting your skin and keeping that bacteria off. Also, another precaution, if you notice that you're turning bright red, you're breaking out into a rash, or you're having any sensitivity reaction, please jump in the shower, rinse the stuff off really good, take an antihistamine like Benadryl, call your surgeon's office, let them know, hey, this is what happened, and stop using the product. The last thing we want to see is you come in on the morning of surgery. If you've got a rashy leg, they most likely will send you home and not do surgery. So we want to avoid that. Hand washing is the #1 defense against infection. You want to be washing your hands religiously while you're here. You also want to make sure your healthcare team is washing their hands. And by the way, you may not notice that because our hand dispensers are in the hallway outside the room, outside each room. So our nurses tend to click those on, wash their hands as they're walking into the room. But please feel free to ask any of us, did you wash your hands? That's an important thing. You also want to encourage your visitors to wash their hands when they come into the rooms because we want to protect them, we want to protect you, and we want to protect our staff. So that's a win-win-win situation for us. We're very proud to have a very robust infection protocol at Reading Hospital. We can boast that we have a very low infection rate that is competitive across the nation.